Hello, my name is Cruz, and I want to talk about how the COVID pandemic has affected those who are still using or those that are in recovery. With the pandemic currently happening, government officials gives them the idea that they must isolate themselves in order to prevent the virus from spreading. But with this idea, puts them in stress, knowing that they might be near somebody who might be infected with the virus. And with this, reminds them how they cope with stress with their addiction. Because according to the Attorney General Yost Scientific Committee on Opiate Prevention and Education, more people died from opiate overdoses in the spring of 2020 than ever before in Ohio, topping a previous historical high reached in 2017. With that being said, I want to remind those that are still using or that are in recovery that you are not alone and we want to help.
Hi, I'm Rachel Underwood, and I'm going to go over the job loss and the homelessness levels that have occurred during the pandemic of COVID-19. So 1 in 5 adults are behind on rent due to the pandemic, and 1 in 6 adults with children are lacking sufficient food in their household. 22 million jobs have been lost, and that's going to take roughly 4 years to recover. 69 million filed for unemployment benefits, and only 6.1 million actually received those benefits. COVID-19 will cause twice as much homelessness as the Great Recession that occurred in 2008, and there's an estimated 603,000 working age adults to be homeless by the end of 2023. That's a 49% increase nationwide. It's a chain reaction. Job loss, less income, food insufficiency, behind on rent, homelessness, alone, increase in drug use, increase in overdoses and deaths. We're in this together. There is help.
My name is Maddie Lemieux, and I would like to spread awareness about the correlation of substance use and loneliness, especially during the COVID-19 pandemic. A study conducted in December of 2020 states that 3 out of 5 people consider themselves to be lonely. Many of these people turn to drugs to cope with their loneliness. To numb the pain of being isolated, they use substances to fill the void in their lives. As we grow more aware of the virus and how easily it spreads, people are lonelier than ever. We must recognize the correlation between increased loneliness during the pandemic and how easily this issue can transform into substance use and abuse. During the pandemic, we must provide social support to others and actively check up on our loved ones. Though physical distance is needed during the pandemic, we should make that effort to connect and interact with others socially. Though our physicality is limited, that does not mean our verbality should be limited as well. Let us prevent abuse and overdose numbers from climbing by staying connected. Be that somebody to lean on. Together, we are resilient.
COVID-19 pandemic, it is no surprise that mental health problems have in fact risen. From depression of being alone and distance to the anxiety of wondering what will happen in the future. Public and mental health experts evaluated the relationship between depression, anxiety, and substance use during the pandemic and found out there was a major increase amongst young adults. Between April 22nd and May 11th of 2020, 1,008 participants between the ages of 18 and 35 were recruited through social media to complete a survey of how they were during the pandemic. 80% reported significant depressive symptoms, 61% reported moderate to severe anxiety, 30% disclosed harmful drinking levels, and 22 to 38% disclosed moderate to severe substance use. Participants reported significant increases across mental health and substance use since the beginning of the pandemic. Reaching out to close family members and friends, as well as virtual support groups, can help in major ways, especially if what you need is support or to simply talk about the problems that you are facing. Though at the time you may feel alone, there are many resources available that can offer a lot of help and support to those in need.
Hi, I'm Brent Delgado, and most of you may know me as the president of Psi Beta here at Lakeland Community College. And others, you may know me as your student or your classmate, and some of you, I'm lucky enough to call my friends. But what some of you don't know is that I'm also a recovering addict. And just like the rest of you, I've had a rough year. I started school back in the fall of 2019, knowing that the following year was going to be a rough one. I thought I was prepared to balance going to school full-time, having a full-time job, all while focusing on my sobriety. But what I wasn't prepared for, just like everyone else, was the COVID-19 pandemic. And when the pandemic hit, I didn't know what I was going to do. I lost my job for 3 months. I've lost loved ones. I've experienced broken relationships. But the worst thing for me about this pandemic was not being around you, my friends, my family. But with all those negatives, 2020 didn't come without some positives. At my job, I was named Employee of the Year. I got voted President of Psi Beta. I earned my associate's degree here at Lakeland Community College. And I also got accepted to Ursuline College, where I'll be studying art therapy in the fall. And along the way, I've had the opportunity to meet some really, really amazing people, and I've built relationships that will last my lifetime. And after all that, as of today, February 20th, 2021, I'm lucky enough to be 2 years, 6 months, and 26 days clean. We do recover. I can't tell you what will work for you, but I can share with you what works for me. You did. Because of you, my fellow students, my classmates, my professors, my family, and most importantly, my friends, I stand resilient. I cannot begin to tell you how many different messaging or video chats I currently have downloaded on my phone. I've spoken to my friends on the phone more over the last year than I ever have before. My cousins and I, who are literally spread all over the globe from Chicago to the Philippines, have all reconnected thanks to the Elgato clan Zoom meetings. Now, human connection is always be essential to fostering resilience, as well as my sobriety. This video project has been a huge help with that for me personally. It's brought a lot of people together at a time when we couldn't be further apart. I've gotten a chance to meet and work with so many new people. It's amazing. But I hope that this video and my message and this entire project will continue to bring people together. My fellow students in recovery, you are not alone. There's a lot of us out there. If you're struggling, there are resources available. And to those of you who don't know me, get to know me. I'd really like to get to know you, because together we are resilient.
If you or a loved one are struggling during these difficult times, please remember you are not alone, and together we are resilient. Personal counseling and psychological services are available to every Lakeland student through the Counseling Center at 440-525-7200. If you or a loved one are seeking substance or mental health treatment services in the community, please call 440-918-2000 to reach the Compass Line, a service of the Lake County ADAMHS Board. Operators can connect you regardless of insurance to services not only Lake County, but surrounding counties as well. If you or a loved one are experiencing a crisis, please call the National Suicide Prevention Lifeline at 1-800-273-8255 or text the crisis text line by texting 4HOPE to 741-741. If this is a life-threatening emergency, please dial 911.